So in urology, which is my specialty, there are two cancers where vaccines have been developed. One is for prostate cancer and one is for bladder cancer. So the idea behind vaccines is that we introduce the vaccine into the body, so it makes the immune system of the body produce antibodies that will fight the cancer cells. So preventative is where you're trying to prevent the cancer from developing. Well, therapeutic is there already is a cancer, and you're stimulating the immune system of the body to fight the cancer, destroy the cancer.
Some vaccines are designed to prevent cancer from spreading further. Vaccines such as Provenge and Sipulus LT specifically target prostate cancer that has metastasized to other areas of the body.
So the basic technique is that blood is drawn from the peripheral blood, and then they use called mononuclear cells. Those are the cells that produce antibodies, and then they are extracted and then incubated in a solution. This one is prostatic acid phosphatase. It's a chemical. And then after incubating it with that, then is reintroduced into the patient. So it stimulates the immune system of the body to produce antibodies to fight the cancer cells. So, I mean, the results are not, I mean, fantastic or miraculous. It does cut down the amount of cancer. So there is one way that we check to see if the cancer is progressing or not is an enzyme called PSA, or it's called prostate-specific antigen. And from that level, we can tell how much cancer there is. So if you give the vaccine and then repeat those blood tests serially, we can tell, okay, is the PSA coming down or not? And from that, we can estimate, is it helping or not?
Bhat says that the results of these vaccines can vary, with most showing only minimal change. However, they are approved by the FDA.
Because it's not so easily available, they would have to go to a center where they do specialize in that. And it's not very commonly available.
BCG is commonly used when treating bladder cancer, but distribution of the vaccine is often limited to larger facilities that specialize in treating this disease.
So the bladder vaccine is called BCG, which stands for Bacillus calmette-guerin. It was actually developed as a vaccine against tuberculosis. And so basically you're using live but attenuated mycobacterium, which is the bacteria that causes tuberculosis. Initially they tried it like a dermal into the skin, but the standard technique now is putting it into the bladder. So this is usually done for bladder cancers, which are not for low-grade cancers because there are certain side effects associated, but high-grade cancers which you think are going to continue growing or progress or spread. So, and again, it has to be done before it has spread or gone into the muscle coat of the bladder. So that certain stage of cancer, that's when we use it.
There are benefits to these vaccines, but it's important that patients are aware there are side effects caused by them and other cancer treatments.
As far as the BCG is concerned, there's been a lot of research done on that. And so right now they have come to a stage where they pretty much know when to use it, how to use it, how to look at the results, and when do you stop. Because say I took out a tumor, did the treatment, and then I go back and the tumor came back, and I cut it out, and again it's another high-grade tumor. So I might say, okay, let's do another series of treatments. But if you see that it's not working, then you have to go ahead with the following treatment, because if you don't do it, the cancer is going to grow and spread, and you want to get it before it spreads. So then you got the other options, which are major surgery or radiation, chemotherapy, and stuff like that.